Hello, and welcome to Diagnosing the Barriers, the Right to Health in Israel and the OPT, a podcast from Physicians for Human Rights Israel, or PHRI. I'm your host, Natalie Foster. PHRI is an Israeli nonprofit organization that promotes the right to health for all people living in Israel and the Occupied Palestinian Territory, or OPT, through the direct provision of medical care and policy change efforts. In this episode, I am joined by Asiela Boras, Director of PHRI's OPT department. We will be discussing the ongoing and devastating humanitarian crisis in Gaza as a result of the Israel-Gaza war. This episode touches on a fast-evolving situation, and it was recorded on March 27th, so some of the information has changed. Asiel, thank you for speaking with me.
Thank you, Natalie.
So currently in Gaza, we are seeing a humanitarian crisis unlike anything before. There is a lot of international coverage in the media regarding the limited resources of food, water, medicine, and more. And I want to get into all of that with you. But I think it's really helpful and important that we start with the context of the conversation on Israel's broader occupation and the policies in Palestine, because the war has only exacerbated the limited aid and resources that have been available before October 7th. So can we start a little bit by talking about the historical background, the context of Israel's 17-year blockade on Gaza?
Mm-hmm. Yeah, you're right. I think it's very important to start from that because people tend to forget that this situation didn't start on the 7th of October. Where I think it started not even on the 17 years ago. We're talking about Israel has been occupying Palestinian territories for more than 55 years. Mm-hmm. The public, I feel, tends to forget that in this current aggression on Gaza, that Palestinians have been under military occupation, the West Bank, East Jerusalem, and Gaza for more than 5 decades now, and Gaza has been under a blockade for the past 17 years. The blockade, I feel it just, as you said, is just intensified on the 7th of October. Mm-hmm. But for the past 17 years, Israel has been imposing restriction on the movement of goods and people in and out of Gaza Strip following 2007. Since then, the exit and entry into Gaza is prohibited by sea, air, and land. So people will say that there has been a disengagement plan in 2005, but we see that Israel is de facto the occupying power. It is like this by international law, because it controls Gaza's population, registry, telecommunication, export of goods, movement of people, students, patients, medical equipment, as you said. And we see it as a form of collective punishment that is prohibited by international law, because it just restricts the flow of essential goods. It contributes to economic hardship. It limits the freedom of movement for Gaza's residents. Also, through this blockade, we see that Israel has facilitated decades-long policy of the development of all aspects of life. So if we look to before 7th of October, the Gazan population have been suffering from limitation of electricity supply. It's not something that just happened now. It didn't start when the siege started in October. But Gazans there were about 5 hours of electricity shut down, at least 5 hours of electricity shut down before the 7th.
Per day?
Per day.
Wow.
I want to say half of the population were classified as food insecure prior to the 7th.
Okay.
And employment was just staggering. It was almost 50% of the population were unemployed. And most of the population lived below the poverty line. So this whole situation didn't start on the 7th. Israel has been managing, have been controlling. Palestinians before have been controlling aid and have been just developing every aspect of Palestinian life.
Yeah. The playing field wasn't even in a way. And then when the war started, it reduced everything that already was sort of in a negative, and has made everything so much worse. And so can you talk a little bit too now about like what is happening We see in the media a lot of reports regarding entry of trucks and aid and, the difficulty accessing aid within Gaza. So can you talk a little bit just to paint the picture of like what is happening? What is the situation there?
Yeah. So to say that the situation is catastrophic is an understatement. Since when Israel launched this current aggression, the first thing that for the first 3 weeks, nothing came inside Gaza.
Wow.
Nothing, no food, no water, no medical supply. Israel had cut down electricity, water supply for a 2.2 million people population.
Yeah.
For over 3 weeks. And when it started going in, it was very, very low. So prior the 7th of October, 500 trucks on average came into Gaza.
Okay.
And for the first, until I want to say the first truce, if we want to call it a truce in November, less than 100 trucks came in. Not even less than 100, it was like about 50. And I'm looking now on the chart of the UN, of OCHA, and yeah, like less than 50 trucks on average came in for a population of 2.2. And aid agencies and the UN already started voicing an alarm that the population is starving. And even in the truce period, the average was about 150, much lower than the average before. And of course, the needs have been intensified,
right?
Because Israel, I think by November, 9,000 Palestinians were killed.
Yeah.
It just annihilated and destructed. So because the needs just got intensified since the 7th. There were no infrastructure, no healthcare system to take care of the wounded, the patients.
Yeah.
Not just there's also reports that Israel targeted bakeries, targeted agriculture land, so the people couldn't make their own food, couldn't buy their own food, so they were dependent on donations and aid from outside coming inside, and Israel blocked that, obstructed that. So even now, it's still very low. 6 months in, almost 6 months in, and the average is about 160, 170 trucks per day. It's so low. Israel has been using a lot of excuses that people are taking over the trucks, or it's not secure enough to go to certain places like the north. But Israel was the occupying power before the 7th, but now it actually has troops on the ground. So its obligation, not even legally, but morally, is to feed the starving people. Its obligation is to secure the trucks, to securely access every part of the Gaza Strip. And actually yesterday, there were another massacre of people waiting for aid. Israel shoot people waiting for aid. 20 people were killed. Of course, Israel had... they claimed that they didn't shoot the people waiting. But so much incidents like this happened since October that it leaves us wondering why Israel is really targeting aid. Why is it using starvation as a weapon of war? Why is it using it as a bargaining chip?
Right.
Leaving 2.2 million people starving.
Yeah. And so it is, I know that the UN Secretary General sort of described yesterday, it was like a moral outrage. And when aid is brought into Gaza, is Israel in charge then of distributing the aid? Is there any way to speak about sort of what's happening once it is allowed to enter?
So as occupying the Strip, Israel should be responsible now to distribute the aid. And also to facilitate and coordinate between aid agencies that want to distribute this aid.
Right.
UNRWA, for example, had been trying to the biggest aid agency working in Gaza, who is under delegitimizing campaign since the beginning of the war. Actually, many years prior to the war, Israel has been obstructing their access to the north of Gaza to deliver aid. And it's deliberately really working hard on limiting aid, limiting coordination, not facilitating it, and using, I want to say, like last resorts method, like the aid that is being dropped by air. Of course, this is by the coordination approval of Israel. This, yes, they can approve and they can facilitate, which is costing much more than just letting trucks come by land.
Right.
Or the new outrageous thing that USA is doing is building a pier to deliver aid. It will take weeks, and not just it costs a lot. While in this period they could like let in just enough trucks. What they just need to do is to pressure Israel, open the borders, let more trucks in. And when I say it, not just Rafah, I think the aid should come through all borders that Israel is blocking right now. And I feel like the international community is not doing enough, and they're just using these patches to close the gaps that Israel is not doing, like this airdrop, which even it cannot deliver the necessary aid what the population needs. So far, a recent number that I saw was that so far the Jordanian Air Force and the USA have been able to deliver through that method only 40,000 meals when 2.2 million people are starving. This is outrageous. I call it a diplomatic circus. And I'm sad that it's working because people are focusing on that instead of actually pressuring Israel to limit the arbitrary inspection and, I don't know, like denying a whole truck just because they found a medical scissor inside. There is also no clear list of forbidden items, for example.
So it's just sort of whatever they find that they think might not be suitable for entry, and then the whole thing is scrapped. In a way.
So for example, there was a recent investigation by CNN that they didn't let dates in for whatever reason.
And you started to talk a little bit about the number of people who are facing starvation, and so I would like to get into a little bit about some of the numbers on the ground, and just the sheer scale of the number of people who are lacking access to food, water, medical care. There are particularly vulnerable communities who are not able to receive the care that they are needing to survive. So can you talk a little bit, what is happening there? Is there anything that we see as being done?
So a recent report by the IPC scale, which is a scale backed by UN and other groups, like the Food World Program, had classified the whole population as food insecure. 2.2 people are food insecure. They actually had their first report was issued in December, where they warned that 300,000 people are classified as the highest food insecurity stage, which is famine. And I want to believe that it could have been stopped. It could have been stopped back then. Right now, a new report actually was issued only last week, where now the number is 1.1 million. Since then, the whole north of Gaza is on the brink of. We're like few days away from famine there. And the projection also saying that by July, also the south of Gaza will be classified as famine, which is the highest scale by the IPC. This will be the third time in which the IPC classifies a place as famine since it established in 2004. It's just outrageous. Instead of these numbers should shake the international community, the medical community, medical association. Instead, they're just hung up on the most insufficient possible ways to deliver aid. Yeah.
Like, and you sort of said this earlier, of it being like just a band-aid on a problem that is so much deeper than just needing, one solution. It requires a lot of coordination, and of course Israel allowing delivery in, and at this point it sort of feels like a real impossible hurdle. And I don't know, as you're describing it feels like it's just really unfathomable. I can't, you can't really wrap your brain around everything that is happening and has been happening. And the ICJ ruling in late January attempted to kind of try to put in, I think, a solution in a way by issuing these 6 provisional measures as part of the proceedings that were initiated by South Africa against Israel under the Genocide Convention. And so one of these measures explicitly had instructed Israel to increase the amount of aid that was entering Gaza. It sounds like that has not happened.
No.
So can you talk just a little bit, if you can, about the ruling and then what Israel was supposed to do, and maybe if there are any ramifications, or how the international community is trying to encourage this, the following and the entry of aid, which you did touch on a little bit, but if you can just get into a little bit of the details.
So, the ICJ ordered Israel in late January. There were 6 provisional measures. One of them to let more aid in, to take immediate and effective measures to enable more aid to Gaza. However, less aid has gone daily into Gaza as compared to the average daily trucks entering before the ICJ ruling. So before the 7th of October, the average was 500 trucks a day. However, in this month where Israel needed to show that they're improving, quote unquote, the situation on the ground, 156 trucks enter daily on average. And it's not just that. It's not just Israel only. I said it's not that it's only not letting aid come in, but there were numerous since October, but also from since the ICJ ruling, that Israel is also making it extremely challenging for humanitarian worker and delivery to deliver aid. It's targeting them. This is the highest number of UN workers who have been killed in any conflict in the world.
Wow.
There's continuous denial of aid delivery to northern Gaza. For example, UNRWA hasn't been able to access the north of Gaza for the past month. For example, now Al Shifa hospital is, since Monday, for a whole week, it's been sieged. No mission is able to access there to give food, fuel, medical supply to the patient, to the doctors that are being besieged inside the hospital. Israel is targeting humanitarian aid trucks. There's many incidents of targeting of Palestinians while they're waiting for humanitarian aid conveys. And this is just a few of how Israel is using starvation and obstruction of aid in its war machine as a tool to, they call it fight Hamas. We see it as a war against the Gazan population, to annihilate the population, to destruct the population, to not leave anything for the day after, to not leave anything after that.
Yeah.
It will take years. In PHRI, before 7th of October, we were talking about the implication of the war in 2014 and 2009 that was left on the Gazan society, on the medical healthcare.
Wow, like a decade plus long
Yes.
impact of, yeah.
So imagine now, we're talking about 32 people killed
32,000.
in 5 months. Most of them were killed in the first 2 months. More than 70,000 people are wounded and injured. It will take decades for the healthcare system to be rehabilitated, to be built again, for the Gazan society to bend the broken pieces, whatever that means.
Yeah. No, it's a unbelievably long road, I think, that lies ahead. And so in closing, I do want to try to look toward the future and to the day after the war ends. What are some of, the immediate steps as soon as there is, an official ceasefire, as much as you can sort of think, and then also what is PHRI doing specifically sort of to prepare our work and the direction to help the rehabilitation and the people of Gaza?
So I think it's really, really hard to think about the day after, not just because it seems impossible, because Israel has annihilated everything, every social system, every all of the infrastructure. It will be very hard to go back and to rebuild again, but also because I feel like as Palestinians, we still are, I want to say, haunted by the pictures of previous aggressions in 2021, 2014, 2008. I still remember vividly the images from those wars. What we've seen is it doesn't compare to anything we've seen before. It will haunt us, I think, forever. And for that, I think the road to rehabilitate and to rebuild Gaza is a long road that will take years, if not even decades. But it's a long that we have to go through. And I think it will start by first of all a ceasefire. But I think one of the key things to take into notice, and that we should also take care of, is that health, equity, and Palestinians' life and the Palestinian issue cannot return to the old normal, where Palestinian health and their access to health in Gaza and in the West Bank is just reduced to a humanitarian realm and humanitarian cases, where Gaza is segregated from the rest of the OPT and left for Israel's policy of de-development and subject to repetitive cycles of destruction and again reconstruction every few years. And for that, the international community should reevaluate its policy toward Israel and consider different measures and sanctions to ensure that it respects international law. And in terms of this current aggression and previous aggression, there should be independent investigation for war crimes. And the international community also should end Israel's decades-long impunity that made us get to where we are today.
And is there anything that PHRI is doing specifically to work on, preparing for that?
So it's, as I said, it's super, super hard for anyone to predict what will happen, because right now the Israeli killing machine is just continuing. Only last week, 500 people were killed, and the numbers are just going up.
Yeah.
And the wounded are just people are dying from starvation. Only I think the number is now standing on 27 people. Most of them are children who died from dehydration and malnutrition. And all of the efforts for a ceasefire and for a deal are just not happening. So it's hard for us to imagine what will be next. But just because it's hard, it doesn't mean we should not think, even if it's super hard to like imagine what will be after. We're working on a requirement and principles to uphold Palestinians' right to health, and we outlined 10 requirements for immediate relief and early recovery efforts in Gaza.
Okay.
Which focus on public health and health provision, for displaced people, for children, for mothers, pregnant women, and the first thing, as I said, is to lift restrictions on Gaza, to resume the operation and to enable the reconstruction of the health facilities, the healthcare system, and then we should also safeguard and respect healthcare workers and facilities. It includes, of course, ambulances, and to facilitate the freedom of movement of IDPs and also it should include also their right to safe return to. There's nowhere to go back to. We cannot say to go back to adequate housing in Gaza. But when we look on the long-term steps for the rehabilitation and sustainability, as I mentioned, we should make sure that the community is part and involved in all policy designs. And I think most importantly, we should advocate for accountability and respect and protect healthcare facilities and healthcare workers.
Yeah.
And any kind of solution cannot be only humanitarian solution. That's why we're against all of these namings of humanitarian ceasefire. Every solution should be a political solution where it will ensure freedom of Palestinians, their security, and full individual and collective right for self-determination in all aspects of life, in all the occupied Palestinian territory.
Thanks, Cecile, for taking the time to describe what is happening currently in Gaza related to much needed aid and the humanitarian crisis that is unfolding before our eyes. We have touched on broad issues relating to the delivery of aid to Gaza since October 7th, and PHRI's own efforts offer some insight into how those challenges are encountered by specific aid actors. Since November, we've been trying to deliver medical supplies and medication to Gaza, which is something we used to do regularly and without much difficulty, but we've been really unsuccessful thus far. While we used to deliver aid through the Israeli crossings into Gaza, including Kerem Shalom and Erez, the military has made it clear we can only now deliver aid through Egypt via the Rafah crossing. So the situation in Rafah is in itself extremely cumbersome and untransparent, and many aid actors are struggling to work there. For us as an Israeli organization, there's an additional layer of difficulty. While there is no official prohibition on Israeli NGOs delivering aid to Gaza, our Israeli bank has refused to release funds for any purchases of aid whose destination is Gaza, even though the official military policy is that there is no such prohibition. So far, we have not been able to overcome these obstacles, and the military has ignored our request to intervene with the bank, or at the very least, issue a letter granting us official authorization to deliver life-saving and much-needed aid. I think this fits into the big picture of what is happening and preventing the entry of aid into Gaza. And we hope that it is a change that is made soon in order to start rebuilding and, at the very least, providing life-sustaining supplies that is desperately needed currently in Gaza. So thank you again, Asil, for sharing and joining me today. Thank you, everyone, for listening. If you are interested in more information, you can visit our website, and we always welcome questions or comments at mail@phr.org.il. Thanks again for listening to this episode of Diagnosing the Barriers, and we will see you next time.